Let's see. Yo, yo. What's up? What's up? Instagram Live. Gonna try a YouTube Live today, but I'll keep it on Instagram Live too. So I'm gonna throw this on here. What up, Kyle Nutter? Let's see. Yo, yo. Sorry, trying to get this tripod figured out for my phone. Doing, trying YouTube Live here. First time I've done YouTube Live. So, it's weird because it's super delayed. I don't know if that's an issue with my internet or what, but when I see it here on the streaming service, it's good. But then I look at the feed on my other computer and it looks delayed. What up? What up? What up? David Nutter. What up, guy? Kyle Nutter. Zace World. What up? Nlog913. Jack. What's up, guys? We're going to try a YouTube Live. I don't know how this is going to go. But, yeah. If you guys follow me or you're subscribed to my YouTube channel, go check out the YouTube feed because I'm curious how it looks and how it works. because this is the first time doing a Q&A on YouTube. So we're going to see how this goes. I don't think the video quality is that good, but it'll be all right. Do you guys have questions? Medical sales questions. Annie Rude, what up? Kevin Stammen, what up? What up, what up, what up, what up? What we got here? Yo, yo. I think it's working on YouTube. Somebody go to YouTube and see if it's functioning. The YouTube Q&A live stream. Hope you and family staying safe and healthy. Thanks, man. Yeah. We're quarantining pretty hard because the wife is pregnant, and we don't know. We have no idea how the virus would interact with somebody that's pregnant and or the baby. So she's due pretty soon. So how's your work been affected? What are you doing in the meantime? Work is extremely affected. Most places have either shut down or significantly reduced any elective surgeries. So the majority of the docs I work with are not really doing surgery right now. They have some surgery scheduled for early next month, but I'd be surprised if they started back up then. So I don't know. I essentially just spend my time trying now to email a bunch of the doctors that I've been trying to get in front of to see if, while they likely have some downtime. Jack, what up, guy? I see you on YouTube. Thanks, man. So this is working, but I think it's like super delayed on YouTube, which is annoying. I got to figure that out first time. Yeah, just emailing a bunch of docs trying to get in front of them. Yeah, I don't know. We'll see. It hasn't been like super. I mean, I've only been doing it like a week. Like last week was essentially the first time I started being pretty much just working from home. So how can you sell right now without sounding insensitive? I don't know. I don't know. That's what I'm trying to figure out. I just say, hey, I'm sure, like in the email that I send is, hey, I hope you're doing well with this whole situation. I'm sure your schedule, or I assume your schedule, is significantly slower than it typically is. If you have any free time, check this out, essentially. Some version of that. Yeah, I mean, I don't know. I don't know what it's about. You just don't want to be overbearing, I think, because your docs are probably at home with their families, doing their thing. So I try to keep it appropriate. So I just say, hey, if you have any free time over the next couple of weeks, and you're interested, check this out. How long do you think elective surgeries will be postponed for Colby? I have no idea, to be totally honest. I don't know how long elective surgeries are going to be postponed. Probably I don't know. It's a total guess at this point. Who knows? I mean, if it happens next month, that's probably a win. And that would actually be a win for everybody, because like we're not going to be doing a bunch of elective surgeries until this thing is pretty much ran its course. So, I mean, that's my assumption. So, yeah. If we get surgeries started back up next month, that would be fantastic, probably. Hang in there. Yeah, man. Shrode boss. All my docs are shooting for May reschedules. Yeah. April would be a win. I think that would definitely be a win. The Book of Z. What up? Some already a couple weeks for me. Ascension in Michigan, 45 days and elective surgery. Not expecting to see electives in April, but who knows? Yeah, pretty much same. All right. Do you guys have questions? Or I titled it Medical Sales Q&A, and everybody just wants to talk about coronavirus, which is not surprising. But do you guys have questions? If any of you have any idea also on streaming on YouTube, I could use some help with that, because I see the stream up here in my feed is like delayed significantly. So when I look at the YouTube live stream, it's significantly delayed to the point where it's like borderline not usable. Hey, how do you prepare as rep if something like this happens again? How do you prepare if something like this happens again? I don't know. I mean, you got to realize, like, so much of this is out of the control of the rep. Like, I don't have like, I'm not a clinician, so I'm at the mercy. That's just the nature of the business. I'm at the mercy of the doctors and the patients doing surgeries. Like, there isn't a whole lot that I can do other than just try to grow the business that I have. Like if something like this happens again and like surgery shut down, like, I have zero control over it. So I think it's more about focusing on what I can control, which is grow market share. That's really the only thing. Yeah. I mean, I just can't envision anything else that I would do different. Like, if surgeries aren't going to happen, like, I'm not, like, who am I? Who am I to tell people that they should start doing surgeries, right? Like, just grow the business. Popped in as you were answering already. So sorry. Have you texted any guys you're close or friends? Texted any guys you're close or even friends with to reassure them you're always ready to help however they need. I guess I haven't. I haven't texted anybody, any docs that, like, always ready to help for whatever they need, however they need. Are you thinking like surgery based, or are you thinking just like general life? In life. Glad you're doing well. Have to get ready to go to work at Target. Stay safe and healthy. Yeah, man. Thanks, you too. Luckily, I'm a top rep. Do you think reps will get laid off, or medical companies will lay off? I don't know. I mean, it wouldn't surprise me. It also depends on the compensation model. So, I mean, a lot of reps that I know that are at least in the ortho space, a lot of those reps are not 1099, but they're 100% commission based. So, if I'm the organization, like, unless you have a compensation plan for those people, you don't have to more or less pay them. Hopefully they've been saving money. But if they're 100% commission based, then you probably don't need to lay those people off. But if somebody's taking a pretty significant salary, there's certainly some potential there. I think it also depends. Like, I mean, I can't go too far in the weeds, but, like, I'm working for a startup company, and our viability as a company, as a startup, is a lot less impacted by our day-to-day cash flow and our AR and AP, right? Like whatever the AR and AP that's helping to fund the business, like, that's because we're a startup. That's like a very small percentage of the revenue to run the company. So, yeah. But if you're a company that's heavily reliant upon cash flow, then that could be a problem. And you're going to look for ways to get rid of people if, money talks at the end of the day. Luke Lenhart, what up? Devin DD2. Showed boss, I was thinking surgery based. All I have right now is trauma. Yeah. I mean, I think the only thing anybody in the ortho space has right now is trauma, for sure. Or close to it, at least. So I haven't said anything to answer your question more specifically. I haven't texted with them about, like, surgery-based stuff. But it's also because, like, the products I sell are, at this point in time, aren't products that, like, they need help with. Like, they know how to plug in a shaver. So it's, I don't know. Hunter Fulcher, what up? S Wood 2405, what up? Preston Brooks Abbott, Ben Zerzin, what up, brother? Quick break at work. You too, Guy. S Wood 2405 in the house. Do you guys have other questions? Is there anybody out there that's like trying to get into medical sales? Yeah. What do you guys want to talk about? Just curious how this first YouTube live would go. It's turned into Instagram live. That's fine. 4 people watching on YouTube I see right now. You guys have questions? Anybody like trying to get into the industry? I mean, now would be the like. I think the biggest thing people can do is reach out to people on LinkedIn if you're trying to get into the industry, and that's going to work a lot better when people are at home all day trying to figure out how to spend their time. Like all the people that are in the actual sales jobs. So like now, in my opinion, as long as you are appropriate about it, now's the time to, like I would be reaching out to freaking everybody that works for the companies that you'd want to work for. What's work-life balance with a smaller company like yours compared to a larger device company? I think a little bit depends on what you mean by work-life balance. I'm going to say, like I'm going to assume when you're asking that, you're talking like hours spent working per day. I don't know. I guess maybe I'm an outlier, but like I just spend as much time as I can working. So I don't see a huge difference when I worked for the big companies versus working for a smaller one. Like it's just what is taking up your day is different. So like if you're working with a large company, I just had surgeries all day for the most part. And then I would spend a lot of time driving around and setting up surgeries for the coming days. But, you know, working for a smaller company, now it's just a matter of a lot of cold calling, a lot of follow-up, a lot of trying to just grow the business, interacting with customers. But like the time I spend per day is, you know, very similar, I would say. Someone asked me recently my opinion about medical sales college. I had no input. Do you have any experience with reps who went to those? Yeah, a little bit on the medical sales college. I didn't go, but I've interacted with a number of people who have gone. I would say the feedback is somewhere in the 50-50 ballpark. Maybe even trending a little bit more. Maybe the majority would be quite positive to it, but it's not a guarantee. So like if you actually read the fine print on their website, when you go to the medical sales college and you complete it, you get a certificate of completion. It's like a piece of paper that says, well done. And it's not like you had to get 100%. I don't remember the numbers off the top of my head. It's like 75% or 80% and above, something like that. And you get the certificate of completion. So the value in that lies in how it's perceived by the people that are going to be hiring you. Like think about a degree from Harvard. The degree from Harvard matters only insofar as the person that is hiring for the position that the person who went to Harvard is interviewing for. That degree only matters so much as that person that's doing the hiring thinks that that degree is valuable and carries a lot of weight. So that's really what matters. I would assume, like my assumption is that it's useful and it's beneficial, but I don't know if it's as useful and beneficial as people think. Like it's not Harvard. It's not, it doesn't carry that kind of weight, you know, and they say, I've talked to some people that they say like they get a ton of people that apply and they only accept like, I don't know, 10 or 15%. They only accept like 10 or 15% of the people that apply. I don't know, maybe that's true, maybe it's not. But I have talked to other people who say that there were people in their classes that were not that impressive. So, you know, I don't know what the screening process is like, but I mean, they are running a for-profit organization I mean, I assume it's a for-profit organization. Maybe it's not, but I assume it's a for-profit organization. Like, they're not going to be turning away people. Like, I mean, like, probably not. So the value in a degree from Harvard is the value comes in that there aren't that many people on the grand scale that get a degree from Harvard. Like, it's hard to get into that school, so therefore there's some value to it. So more so the value of the certificate of completion matters on how difficult it was to get that. So, I don't know. It's by no means a guarantee, is the short answer. If you go to the medical sales college, that you're going to be in the industry. Jay Flores, what up? It's Fred Tran. What up? I did get a couple of questions that I might as well bring up since nobody else is asking questions. When are you going to let me consult for you guys? That was a buddy of mine. Asked that question because I posted it on Instagram that I was going to go live on YouTube. And consulting is like a big thing if you guys, about what I figured. Yeah, man. Chime 34, what up? There's a lot of doctors that want to consult for companies, and rightfully so. Maybe they want to grow their name, grow their brand, the business of medicine. Maybe they're just very techie, very engineering minded. Maybe they want to develop products, but there are a lot of people that want to be consultants with companies. And a lot of the companies all approach that differently. So another question I got, if you were hiring a medical sales rep, what is one concrete sales metric that would be impressive? I mean, if you got to choose one sales metric, I would say consistent growth of sales. And the reason is because like when you're running a territory or you're selling any product, it's easy to have micro wins. So like it would be a lot more valuable to me if I was looking to hire a medical sales rep and looking at concrete sales metrics, that for the last 3 years, the sales rep grew the business at, 3 increments and grew it every year. Because it's easy for, let's just take the example of medical sales. You've got a territory. What if like a monster doctor, and by that I mean like super busy doctor, moves into your territory and like starts operating at a hospital or surgery center that is in your account set? Like immediately your numbers are going to blow up, assuming they use your product. But that's not that valuable. Like you're more so just on the receiving end of getting that business, which is fine. No problem. Like by all means, that's the greatest thing in the world. But I would want to see what that rep is doing year after year after year. So if you have multiple years of sales growth, that's probably the number one concrete sales metric that would be impressive. Like you don't want to look at like this person had one good year. Well, you see that like he grew the business by 50%. Like, okay, cool. How much business did they start with? If you start at $100,000 and you grew it by 50% and you went to $150,000, like, I mean, in medical sales, that's like nothing. But if you start at $2 million and grew it by 50%, and now it's $3 million, that's different. But you want to know why that happened. Like having one good year is one thing, but seeing it consistent year over year, that would be the most important sales metric. Let's see, what else? Primetime baseball. What up, my guy? Is that you, Chris? Do you actually run this thing? What's your strategy to grow the business during the virus since elective surgeries are canceled? My strategy is as good as anybody else's strategy when nobody's doing surgeries. It's going to be hard to grow the business when nobody's doing elective surgeries. So my objective is to try to connect with as many docs that I've been trying to connect with for the last 8 months and hope for the best. Maybe I'll be able to get, like, if I could do like a Skype call with the doc, or if I could, meet the doc one-on-one for a coffee or something like that. That's like best case scenario, but like, nobody's doing elective surgeries. So like, you can only do so much right now other than ride it out. Yes, sir. Keep killing it, brother. I see you too killing it. CB. Luke Lenhart. Real G Wade, what up? What was the main reason you left a large company to go to a startup? Well, there's a couple. Like, number one, there weren't any, let's say, killer positions with the large companies that were like, man, I just have to take that position. So part of it was, you look at all the big companies that obviously in the ortho space, you're welcome to think about all those. There weren't any like really killer positions available there. And so that's one of it. But the other was I like the chase. I like the hunt. And if I look at my resume down the road, like there's value in doing a lot of business and working for some of the big companies that are out there, like name them all: Medtronic, J&J, Stryker, Arthrex, Smith & Nephew, DePuy Tech, all those companies, right? Zimmer Biomet. But those companies have a brand and have business. And so like part of the allure for me is I can put on my resume, like assuming this goes well and I don't get fired, right? Like I could put on my resume that not only that I work for the big companies, I also work for a startup company. I took business from $0 when nobody knew who we were, or what we did, or what we sold, to X. And that's like fun and exciting to me. So that's kind of the other reason. I also am a person with a personality type of I'm more open to risk. So I think there's a lot of people that just personality-wise are less risk or more risk averse, and so they'd probably be more comfortable with a large company. And I don't blame them for that, but yeah, I just like kind of the startup world. It's kind of fun. I can totally see myself just doing startups from here on out. And granted, maybe I'll take that back once maybe this goes well and a big company has like a killer position I can't pass up, but I can totally see myself just doing startups. Nick Nissen, what up? Jennifer Larson, what up? Luke, how did you determine that the startup company's products would be worth selling versus sticking to the products of the large company? Knowing what the products were and being in the industry to know how much better that product would be. It's hard to know that ahead of time. It's kind of funny. I'm looking at this. I've got the feed on YouTube because I'm doing YouTube Live, but I'm like zoned in on Instagram Live. So like the feed is me, the camera coming this way is just me looking down at my phone the whole time. So that was probably dumb for me to do YouTube Live, whatever. First time. I need to just put this up here. Why don't I do this? Is that better? No, that's in the screen. Yeah, whatever. I'll just keep it back here. And I screwed up my tripod trying to figure this out. How did you determine the startups company's products? Hope that answered your question, but yeah, I mean, it comes down to me knowing that like the minute that I saw the product itself, I was like, oh, that's big time, because there's a lot of companies that have tried to build the product that we have for a number of years, and nobody's really been successful doing it. So once you're in the end, like it would be hard to know that without having experience in the industry. Like there's a company that I spent a little bit of time with in the past, and like like on LinkedIn, they post these products that the product is like the technology is like 3 years old, if not longer. But if you're outside the industry, you see them posting like, hey, check out our new product. Like, unless you're like, that's not helpful. So, Hamlaj, Hamu, what up? Pedal flow. Andy, get on the trainer. Stop getting on these Instagram lives. Get on your trainer and spin those cranks. Other questions. Other question I got: if you weren't in ortho, what med sales field do you think you'd like to be in? I mean, I could probably like and get used to liking pretty much anything. Like, because it's more so, like for me, it's more so about the sales side of the business than really the nitty gritty details of what you're selling. So I would probably just focus on, like, certainly if I switch from ortho to another specialty, I would want to go to one of the big companies in that specialty. I've had a number of friends that have worked for Boston Scientific in like neuromodulation, and that seems like a really good position potentially. But if I was going to switch from ortho, I would go to one of the big companies. Like, I would not go to a small or a startup company in a different specialty, because I wouldn't have the level of expertise in that specialty, you know. So like, I would want to go to one of the big companies where they already have the business, so that I would get my feet wet and I would be educated on that part of medical sales before I would then take the risk of going to like a startup company. Jam Wood, what up? Zabix, what up? We're working from home right now due to COVID-19. I'm not used to it. Any advice? Try to be as productive as you can. I would think about it from, and I don't remember what do you do for work? I don't remember. Zabix? Zabix? I think it comes down to trying to reverse engineer whatever your customers are doing right now. Like, try to bring something of value to them, you know? And if you don't feel like you have anything of value to bring to them, then be respectful. But, you know, offer up, hey, if you've got some time, check out what we have. So that's what I've been doing, reaching out, email, LinkedIn messages, just trying to be as respectful of people and their time and what they have going. But like for me, this week is going to be a huge content week for me, because like doctors, just like everybody else, they spend their time online. Like, between surgeries, literally I see doctors like playing games on their phone. You know, like they'll pull out their phone and be playing like Candy Crush or whatever. So like, they're spending time on their phones. So if there's a way for me to be able to produce content that, like, I don't know, would hopefully bring them value, didn't think about it that way. Medical sales rep, have to pitch my cardiology product to physicians. That's right. Yeah, I remember now. And your issue is going back into them multiple sales calls for the same thing. I remember that. I remember the conversation we had about that. Yeah, I mean, I would reach out to them through email or LinkedIn, and just, or if they're on other social platforms, if they're on Instagram, like, follow them, like their stuff, DM them there, Twitter, Facebook, whatever. That's where people spend their time. So just try to be respectful with it and say, hey, hope you guys are doing well. Hope you're safe. If you have downtime and you want to see a sweet product, check out my stuff. Something like that. Zabix, loving being a rep. My advice working at home is learning all my products, knowledge, and yeah, for sure. My answer was assuming that you were not new and you knew all of the stuff about your own product and your competitor's product. But certainly, now would be the time to become an expert on your products and your competitor's products. What's up, Cole? What up? How's Mexico? Nicholas. It's Zabu. Am I saying that right? Zabu? Is that Zabayu? Zabiu? I don't know. Sorry, I'm probably just butchering that. Twitter and LinkedIn can help. Yep. Haha. Or YouTube, I agree. So funny. Hunter Fulcher, what up? Have you heard Kevin Brown's podcast device Nation, ortho rep from Myrtle Beach? You guys should link up. Kevin Brown's podcast. No. Kevin Brown. I'll write it down. Is it good? Have you or has anybody else listened to that podcast? Kevin Brown? I did another podcast with Mike Hayes. He reached out to me about doing that. So definitely open to doing those. Kevin Brown. Whose podcast is better? Kevin's or mine? Be honest. You can say his if it's better. Yeah, right, Colby. You have a great memory. New. Haha. Got it. Jeremy Highland. What up? Only 1 month in. Zabiu, what are you doing? 1 month in. What are you doing for work? Who do you work for? For somebody trying to get in the industry, would you recommend going with a larger company rather than a startup? Yeah, I would, Luke. Part of that is like where we're at as a startup right now. Like we don't hire new hires. Like we're not hiring people that don't have any experience in the industry because like as a startup, you fundamentally don't have business, right? Or a smaller company. You're going to say, I'm going to go to like, Chicago here, and you're a smaller company or a relatively small company or a startup, and you don't have a whole lot of business. You're not going to hand that business to somebody that hasn't done it before. So in general, the larger companies that have the business are the ones that have associate reps who they bring in who don't have experience to train them up to then become territory managers. So I would recommend going with a larger company if you can, because you're going to be able to get better experience. Like sports med is primarily what I've done. Like let's say you're selling rotator cuff anchors and you've never done sports medicine sales before and you're new. Like if I were you, I would want to go work for a company that's already doing and selling those products, like a bigger company, so you can learn how do you, like a 5.5 corkscrew. What do you know about that? Like nothing? Oh, well, you would want to spend as much time in the OR as you can learning those products before you go sell them, if you can. So larger would be better, I would say. Larger is better. I have a podcast as well. Medical Sales Talk. Oh shit, what up? What up, Medical Sales Talk in the house? For reps trying to break into the industry. Awesome. I recognize the Book of Z, like I've seen your handle, but I didn't honestly recall what you did. So, hey, YouTube Live, who I haven't talked to in a while. Add questions. If you have questions about med sales, put them in the comments section. Book of Z. How's the podcast going? What do you do for medical sales too? Are you in medical sales or previously, or Book of Z? What are you currently doing? Is the podcast just a side thing for you? Device Nation is solid. Mace Horoff has a good pod too. Very nice. As a doc developing a neuromodulation product, I'll want to find medical reps. How can med reps seek out and represent new med device companies and docs seeking sales reps? As a doc developing a neuromodulation product, are you? Is this just a general question, or are you actually working on a neuromodulation product? Neuromodulation is spinal cord stimulators, is my understanding, for like chronic pain patients. I want to find medical reps. How can med reps seek out and represent new med device companies and docs? There's two questions there. What is the rep going to do if you're trying to find new products to represent? And what is the doctor going to be doing to try to find representatives to represent their product? On the doctor side of things, I think it's pretty straightforward that you would have to utilize a recruiting service, or I would think so. I know there are also a couple of, I don't know if they're companies. I mean, I guess they probably are companies that connect manufacturers with distributors. So there are ways to do that if you were to search, like medical distribution companies or services, things like that. There are ways to post your product on these websites or connect with people that are running distribution groups already to sell those products. That or recruiters, because recruiters are obviously in the business of making those connections. On the sales rep side of things, if you're wanting to find new products to sell, I think it's similar in that you want to connect with recruiters, because recruiters are can be the middle people between the manufacturer and you trying to represent the products. But you also could find those services that connect distributors with companies to find those products and the new up and coming products. The other thing is, if you're a rep looking for a specific product, there are like Mass Device and I don't know, there's a couple other med device focused websites. And so if you look at like list of startup companies, I mean, if you find a young company that you want, if on the rep side of things that you want to sell products for, like figure out who the company is and then go find the people that run that company and tell them that, hey, I want to sell your product. George Estrada, what up? Yeah, I'm a neuro and spine rep. Cool. Ha ha. Nicholas. All right. Neuro and spine. Who do you sell for? YouTube Live. This is a very successful first YouTube Live, folks. I'm going to be doing YouTube Lives very much. Might just be Insta Lives. It was a broad question. Thanks for the input. Yeah, okay. Are you potentially, Nicholas, trying to find people to sell your product? Because I know some guys and gals. All right, well, we've done 37 minutes. Anybody else have questions? Masonics in Las Vegas. Have we talked before? I feel like we might have. I probably have asked you that question before. The Book of Z. I've probably asked you that question before. Looking for an ASR. See, that's how you guys get in the industry. The Book of Z is looking for an ASR right now. Message if you're on this and you're an associate rep or you're trying to get into the industry, freaking message Book of Z. She's looking for an ASR right now. All right, I'm out. Appreciate it. Yeah. You need to be doing a live feed of your entire life the whole day. Yeah, I don't think you want to see that. What? It's Fred Tran. Who, like, what? In all seriousness, when you're saying you need to be doing a live feed of your entire day, or entire life the whole day, what am I not showing out of my day-to-day that would be valuable? Like, serious question. What else, as a consumer of content, what else would be something that I don't show that would be valuable? Yes, LOL. Trying to help you out. Of course, I don't know the people that watch this live stream if they're going to be any good as an associate rep, but we'll see. All right. Well. YouTube Live. 2 comments from Jack Mahomita, and that's it. Unless, like, let me refresh this. Maybe there. Let me just make sure. I think it's only 2 comments. Yeah. All right. I'm going to shut down the YouTube Live feed, and we need a video from the time you woke up to brush your teeth. It's Red Tran. Like, seriously though, what do you want to see that I'm not showing you already?